Welcome back to Why We Nurse. I'm your host, Serena Tobar. Today's episode is one of the most important conversations I've had on this podcast. It's about accountability, it's about patient safety, it's about transparency. And it's about what happens when healthcare professionals are criminally prosecuted for mistakes made in the course of caring for patients. Should nurses be held accountable for errors? Absolutely. But should medical mistakes be treated as crimes? What happens when fear enters the profession that depends on honesty? And what happens to patient safety when nurses become afraid to report errors? These aren't simple questions, but they are questions our profession must be willing to discuss. Let's start with the truth that healthcare has understood for decades. Human beings make mistakes. That statement isn't an excuse. It's not a justification. It's reality. Healthcare is incredibly complex. Every day, nurses make hundreds of decisions. We administer medications, interpret orders, respond to emergencies, monitor changing patient conditions, communicate with physicians and multidisciplinary teams, coordinate care, advocate for patients. And we do all of this in systems that are often fast-paced, understaffed, interrupted, and imperfect. Errors don't occur because healthcare professionals don't care. In fact, they usually occur despite caring deeply. Healthcare professionals are human beings working within systems that are vulnerable to failure. When discussing the criminalization of nursing errors, it's impossible not to begin with the case that changed the national conversation. The case of former Tennessee nurse Serena Tobar. In 2017, while working at Vanderbilt University Medical Center, Vought mistakenly administered vecuronium, a paralytic medication, instead of Versed, a sedative, to patient Charlene Murphy. The patient later died, and Vought reported the error after recognizing what had happened. Years later, the case resulted in criminal charges. In 2022, Vought was convicted of criminally negligent homicide and gross neglect to an impaired adult. She ultimately received probation and lost her nursing license. This case drew national attention. Nursing organizations, healthcare leaders, and patient safety experts expressed concern that criminal prosecution in cases involving medical errors could discourage nurses and other clinicians from reporting mistakes and near misses. The concern wasn't about avoiding accountability. The concern was about preserving a culture of transparency and learning. But the Vought case wasn't the first story that shook healthcare. Many nurses remember the story of Kimberly Height. Kimberly was a pediatric intensive care nurse in Seattle who accidentally administered a medication overdose to an infant. The child later died. Kimberly lost her job. She faced investigation and professional discipline. But perhaps the most devastating outcome was what happened afterward. She struggled deeply with the emotional burden of the event. In the months followed, Kimberly died by suicide. Her story became one of the most painful examples of what can happen when a healthcare professional carries overwhelming guilt, shame, and emotional trauma after a patient event. When we talk about patient safety, we often focus on the patient, and we should. But Kimberly's story reminds us that traumatic events can have profound consequences for the healthcare professionals involved as well. This isn't just an American conversation, though. In the United Kingdom, the case of Dr. Hadiza Bawa-Garba generated similar concerns throughout healthcare. Following the death of a young patient, Bawa-Garba was convicted of gross negligent manslaughter, sparking intense debate among clinicians, professional organizations, and patient safety experts. People held differing views on the case itself, but a common concern emerged. How do we hold individuals accountable while still recognizing the role that system failures, staffing challenges, communication breakdowns, and organizational pressures can play in adverse outcomes? And it's a difficult question. It's one that healthcare systems around the world continue to wrestle with. What makes these cases so significant isn't simply the legal outcome. It's what they represent. For decades, healthcare has worked towards a concept known as a just culture. A just culture acknowledges that human beings make mistakes. It encourages reporting. It encourages transparency. It encourages learning. The goal is not to eliminate accountability. The goal is to understand why something happened and to prevent it from happening again. Many healthcare professionals worried that criminal prosecutions could create fear around reporting mistakes because people may become concerned that their honesty could later be used against them. And that fear matters because patient safety depends on learning. There's another part of this conversation that deserves attention. It's called second victim syndrome. When a patient is harmed, they are always the first victim. But sometimes there is also a second victim, the nurse, the physician, or the clinician involved, the healthcare professional who carries the emotional impact of what happened, as in the case of Kimberly Hyatt. These individuals may experience guilt, shame, anxiety, depression, sleep disturbances, and loss of confidence. Sometimes they often have a desire to leave the profession entirely. Many clinicians replay the events over and over, and they ask themselves, what did I miss? What should I have done differently? Could I have prevented this? Even when they followed policy and procedure, even when multiple system issues were involved, even when the outcome may not have been completely within their control, the emotional toll can be enormous, and too often healthcare workers carry it alone. Now let's be clear. Patients deserve accountability. Families deserve truth. Healthcare professionals should be responsible for their actions. But accountability and criminalization are not the same. Historically, medical errors have most often been addressed through professional licensing boards, employer investigations, quality and safety reviews, and civil litigation when appropriate. Criminal prosecution has traditionally been relatively rare in cases involving medical mistakes. The reason many experts have expressed concern is because punishment alone rarely addresses the underlying system vulnerabilities that contributed to the event in the first place. Over the years, patient safety science has evolved. Today, patient safety experts often ask questions such as, why was the error possible? What safeguards failed? What environmental factors were present? Was staffing adequate? Were policies clear? Were communication systems effective? What can be improved moving forward? These questions don't remove responsibility. They create opportunities for learning, and learning is what ultimately improves care. The fear is that if healthcare professionals become too afraid to report mistakes, near misses, and concerns, organizations lose access to the very information needed to improve safety. So what can we do? How can nurses become part of this conversation? First, educate yourself. Learn about just culture principles. Learn about systems thinking. Learn about patient safety science and how it has evolved. And second, get involved. Join your state association. Engage with professional organizations. Participate in advocacy efforts. And third, talk to your legislators. Legislators need to hear directly from nurses. They need to understand safer healthcare comes from learning and transparency, not fear. When speaking with policymakers, consider advocating for just culture principles, protection for good faith error reporting, second victim support programs, strong patient safety reporting systems, safe staffing initiatives, whistleblower protections, investments in system-based safety improvements. Let's shift the conversation from punishment to prevention, because safer systems create safer patients. I believe we hold two truths at the same time. Patients deserve accountability, and healthcare professionals deserve fairness. We can support families who experience harm, and we can hold clinicians accountable when appropriate. And we can improve systems. We can preserve a culture where transparency remains possible. Because if fear wins, learning loses. And when learning loses, patient safety suffers. At its core, this conversation is not simply about criminal law. It's about culture. It's about trust. It's about creating healthcare systems where people feel safe enough to speak up, where mistakes are reported and where lessons are learned, where patient safety remains the goal. The future of healthcare depends on our ability to balance accountability with humanity, to seek improvement rather than blame, and to remember that nurses are human beings working within systems designed by other human beings. Thank you for joining me for this very important conversation. If this episode resonated with you, share it with a colleague or friend. Continue the conversation and ask questions. Get involved, because the future of patient safety belongs to all of us. Thank you for listening to Why We Nurse. Follow at Why We Nurse on Facebook and Instagram for more conversations that matter. Have a story to tell or want to be a guest? Email me at whywenursepodcast@gmail.com. Until next time, stay informed, stay engaged, and remember why you nurse.